All right, we are back here at Health, Hygiene and Wellness. We are discussing about hypertension, a disease that Dr. Silas says that I will not enjoy my 40s as it is a risk factor for hypertension. We are discussing more about it in this second half. I would like us to talk about the treatment as well as the diet for people who have HBP. But Dr. when is the time that I should come to see the doctors now for hypertension?
Even today, because you have blood pressure. You know, the moment I know there are grandmothers who are watching me, the first question they always ask a woman, maybe their daughter or daughter-in-law, when they have given birth, is, do you know the question?
No.
Did the child cry? That is the first question they always ask. Did the child cry? Or if they don't ask, they'll call you themselves. And they want you to be close to the child. The moment they hear the child crying, it's always the joy of the mother. The reason why the child cries, that is the period when the transfer of the control of the body, you know, when a fetus is in the mother's womb,
it depends solely on the mother.
On the mother's heart. So when you cut off the placenta, they don't cry because of that pain. They cry because they open their heart. You understand? To start functioning, to start pumping individually for itself. That's why children cry. So that's the moment you start having blood pressure. From day one, you start having blood pressure. It is the blood pressure that sustains you since that period when you cried. But then children, if they don't cry, they die. So you know that?
Yes, yes.
Yeah, if a child is born and they don't cry, they lose their lives.
I heard that they always receive a slap a little bit
no,
at the back.
That used to be done long years ago. But that is the moment you develop blood pressure. At birth, everybody. So you need to always come to us to confirm with us if you still have the normal blood pressure or it is abnormal. Because you can imagine something that you've had since birth. Now, how sure are you that it is still normal? So anybody can get hypertension, whether they're young or old. That's what I mean. From day one, you can still get hypertension. Hypertension, I mentioned that it starts at 40 years, but it is not that it cannot affect young people. We have people who are 2 years, 3 years, 12 years, 13 years who have hypertension. And we have two different classes of hypertension. There is primary and secondary hypertension. So primary hypertension is just hypertension that comes on its own. We call it essential hypertension. It has no cause, and most of the time the risk is age. That is what we are talking about, and is the most common. But secondary hypertension comes because of other causes. For example, pregnancy, which can come at any age. A child who is 13 years can get pregnant. A child who is 10 years can get pregnant. A child who is 18 years can get pregnant and get hypertension. Number two is the use of steroids. I will still mention the use of diclofenac, a drug that causes hypertension. People are still buying it over the counter without doctor's prescription. Not only diclofenac, but even the other drugs, the painkillers that we use daily, they cause hypertension. Number two is steroids, prednisolone. People buy prednisolone over the counter. It causes hypertension. The other diseases like thyroid, goiter, a growth on your neck, it can lead to hypertension. So if you have a goiter, you need to come to the hospital. There are some other diseases which I can't mention, like cancer of the kidneys. Any cancer can lead to hypertension. Diabetes can lead to hypertension. We have even, there are steroidal diseases like Cushing's syndrome. We have other conditions that can lead to hypertension. So you need to come to the hospital if you are still young so that we can identify. You can be having hypertension and you don't know. So we usually start testing blood pressure seriously from 18 years. So anybody who is above 18 years, if they come to the hospital, they'll check. Young people still feel they don't get hypertension, but you can get hypertension. There are people who are smoking bang. Bang leads to hypertension because it increases your heart
pulse. Yes.
Yes, that will lead to hypertension. So if you have ever smoked bang, you stopped, come to us, we confirm if your blood pressure is still normal. So that is the right time to come to the hospital. And for hypertension, it is very simple. We just do a blood pressure check on your arm. It takes 5 minutes. Then you relax again. for 5 minutes, they repeat the same. After 5 minutes, you come after 1 week, they repeat the same. If you are normal, you continue with your life. You will visit the nutritionist to tell you what to do so that you cannot get hypertension. And as I've said, in most hospitals, it's supposed to be free. If somebody has to charge you something, it's not more than 20 shillings. Yeah.
Some would say that maybe high blood pressure is caused by accumulation of fats around the heart. Is that correct?
No, obesity. Generalized obesity can lead to what we call atherosclerosis. So atherosclerosis is accumulation of fats in the arteries. So if it accumulates in the arteries, it can lead to hypertension. Yeah.
All right. Now, Dr. what is the diet that people with high blood pressure should observe?
With diet and hypertension,
what are the foods that they should avoid, and what is that they should eat?
Yeah, actually, what you need to avoid is, let's start with what you need to avoid. Mostly these fats. First of all, they are oils and they are fats. We like people to use oils. The fats are the solid.
Solid, yeah.
Yeah, but the oils are the ones that are in the containers. But I want to mention something. The ones that are in the containers, again, sometimes when you stay with them for long, they become solid. So if you have enough money, just go look for a transparent container that has oils. For example, I didn't want to mention an example, but an example is Elianto. Elianto has a transparent container, the 5 liters, so that you can look at it till the last drop, and it will still be, it has to be liquid.
In liquid
till the
form.
last drop. So if you are using an oil or that is not liquid, that's not liquid up to the last drop, then you need to change it. I don't want to mention the companies because I don't want to look like I'm marketing the companies.
Yes.
But I know what we encourage is plant oil. We discourage animal oil. So if you are using plant oil, sunflower, there is soya, that is still okay. That is what we use. Nyama choma, people take nyama choma roughly. They need to stop. People need to stop alcohol. People need to stop smoking. Stop. Not use in minimal. They have to stop. So they have to stop smoking. They have to stop alcohol by all means because it will lead to hypertension. The refined foods, an example is soda. You need to use minimally. There's these types of drinks that are stayed in the shelves for very long. They lead to hypertension. So you need to stop them. The cakes and the sugary things, they are always converted to fats. If you like taking, especially I wonder, people who stay in offices, they like taking sugary things, the cakes and bean cakes, whatever. I don't know if you do that every day, but it will lead to hypertension. For your information, because why should you take a sugary thing and you are just sitting the whole day? That Mijengo guy is the one that you should buy packets of pancakes and whatever.
You need exercise to break up the fats.
Yeah, to break up to consume the sugar. Because if you don't consume the sugar that you've eaten, it will be changed to fats. And the fats go direct to your arteries, leading to hypertension. So the amount of starch that you are taking, especially the high glycemic index starch, make sure that you take in minimal concentrations. Then salt. I've mentioned about salt. Reduce salt. Salt is a monster for hypertension. Reduce salt. Don't use a lot of raw salt. Yeah, people eat avocados, nyama chomas, they use a lot of meat. Then what you need to eat a lot is all foods, especially vegetables and fruits. Very important. In fact, I always tell people, before you take your food, have your fruits, take them, they'll satisfy you so that you don't take a lot of food. And don't stay hungry. Because when you stay hungry, you have a craving for starch. Have you seen the days when you've taken lunch?
It's true.
Whenever you go take your supper, you take a lot of it. And it is not helpful. So always make sure you take snacks. And your snacks should be fruits in between. So whenever you see a mama passing around, they have bananas, pineapples, promote them. Let their children go to school.
Yes.
With
As you stay healthy.
Stay healthy.
Yes.
Why do you want to go to the supermarket and buy soda, and yet you have left a mama who is struggling? You've not bought their bananas. So just promote them, and you'll even be blessed, and you'll stay healthy. Yeah.
What about the treatment now?
No, so the treatment for hypertension, number one, is what I've talked about. Number one, that takes 50% is diet. Number two, exercise. Exercise, They are the mainstay for treatment for hypertension. You have to lose weight, you have to stop alcohol, you have to stop smoking, you have to reduce salt, you have to reduce fats. Even the oils that we are talking about, don't say that now I have bought Elianto, I can use it well, it will not affect me. The Elianto will still affect you because it still has cholesterol. There is no fat or oil that does not have cholesterol. Everything, even the Blue Band has cholesterol. So make sure you eat a balanced diet with proteins, starch, and fats, and at least something like water. Take 8 glasses of water in a day. Then for the drugs, for the drugs, we will make sure that the doctor will determine, depending if it is stage 1 hypertension or stage 4. So the doctor will know what to use. So
are there any side effects associated with the drugs for hypertension?
Yeah, they can cause headache, they can cause cough. So when you start those drugs, you need to talk to your doctor. And that's why we encourage people. There are very many people, and they are watching me even today. They take drugs. They went to the hospital once, the doctor prescribed drugs for hypertension, and they have taken them for years without seeing the doctor. What they always say, the doctor told me to take the drugs. And they have blood pressure machines in their house. You are doing the right thing. But one day, you'll realize that the drugs you are using are not for you. Because we change these drugs after every 5 years. A drug for a 50-year-old is not a drug for a 55-year-old. A drug for a 60-year-old is not a drug for a 20-year-old. So if you started these drugs 5 years ago, the doctor needs to check your kidneys to make sure they are clearing these drugs. So if you are not seeing the doctor now, you are just taking the drugs. It is good. You are better than somebody who stopped the drugs. But make sure you see the doctor. And we don't want you every day, after 3 months. So come to us. Ask if you are on the right track. Then we tell you you are okay, you are on the right track, you can continue, come back after 3 months.
Now, Daktari, as we wind up, what are the plans or any programs that the government has put in place to reduce the number of hypertension victims or patients?
That's a very good question. And at the policy level, both from the Ministry of Health, the Department of Health, Afya House, they have an NCD division, a department for non-communicable disease. We've really prioritized cardiovascular diseases because they are the leading cause of death. So you can't go for something small and yet we have cardiovascular. So we've had programs, we've had even pilot studies that have been done even in our county, Transvaal. We've gone to the communities to screen. So the government is ready. So at the county level, we are doing community screening. And unfortunately, our people don't come for those screening. You know, people are funny. When they hear that people are coming to screen for hypertension, they will tell those people who have hypertension, wanasema, wewe ndio unakwanga na pressure. Nasikia madaktari wa pressure wanafanya nini? Wanakuja. Weenda. And yet, we were targeting that person who never knew they have hypertension. You realize? So we want people, when you hear that they are screening for hypertension or cancer, if you have never screened, if you don't have hypertension, you are the right target. Go and confirm if you still don't have hypertension. Don't send it to us. People already know they have hypertension. They are on care. Those people will never get a stroke. The people who get a stroke, they are the people who are not on care. And those are the people we are targeting. So the county government is struggling a lot. We have what we call the May measurement month and we will be back here in May. We will be doing measurement of blood pressure from 1st May to the last month, to the last day of May. So those are the programs that are there. Plus, we have subsidy drugs for hypertension. If you come to the county hospital, we have an AMPATH program that is supporting subsidy drugs. So if don't struggle to buy your drugs from the expensive chemists out there, come to the county referral hospital. I know people will say there are no drugs there, but there are drugs that we can give you that will help you at a cheaper price, because you can't buy drugs 10,000 every month. People stop taking the drugs because of the price. So we have really brought down the drugs, and we want people to come so that they can be assisted.
All right. Do you have any last remarks, Daktari?
Yes, thank you. My last remark is to thank the viewers for their time, and we really am a champion of hypertension. I'm so passionate about hypertension, and I really want people to not to die of hypertension. So please, if you're above 18 years, come to us. Anytime you celebrate your birthday, make sure you come for an hypertension test so that we see if you still are okay, you have hypertension or not. Don't fear. People fear that if you are told you have hypertension, you will die the next minute. No, you have the doctor to take care of your life for the rest part of your life. So thank you so much.
All right. Yeah. Thank you so much, Dr. Silas, for that insightful discussion. Actually, I've known much about hypertension and why so many of our people are dying because of this disease. I hope you also find this, you've also found this discussion very insightful. And till next time, this has been Health, Hygiene and Wellness. My name is Barasa Saenyi. Goodbye.